Why is the Hepatitis C Management State-of-the-Art meeting important? And what will practitioners need to know in the coming era of simpler and more effective hepatitis C treatment?
This meeting comes at an historic moment, not just in the management of patients with hepatitis C virus infection, which is a major cause of disease and death in the world and in the United States. In fact, death as a result of hepatitis C has now surpassed death as a result of HIV infection in the United States. But it also comes at an historic moment in the management of chronic viral diseases and in medical care in general, because for the first time we feel confident that we can cure a chronic virus infection. And these advances that have made this possible are the result of some very hard work by a lot of dedicated scientists, and that has resulted in the development of specific drugs that prevent viral replication and allow its elimination from the liver. So individuals who might diagnose hepatitis C or are responsible for treating patients who might have hepatitis C are anxious to learn as much as they can about these drugs and begin to understand how and when these drugs should be given to patients, in particular because the drugs are so expensive. And the manner in which society is going to deal with the cost of treating everyone in the United States and worldwide with this disease hasn't been determined as of yet. But potentially the disease could be wiped out, completely eliminated if everyone were to be treated. So I think it's really important to identify those individuals who are most likely to benefit from treatment and to take advantage as well of advances in diagnosis. Our ability to identify individuals who have developed scarring of the liver that puts them at risk for going on to develop portal hypertension, decompensated liver disease, and hepatocellular carcinoma, the major killers of end-stage liver disease. And so one of the things I think that's very important to discuss with physicians in general is the ways they might refine their ability to pick out those individuals who have advanced disease, because the people who are going to treat hepatitis C in the future are not the specialist hepatologists. These are the specialist hepatologists will go back to taking care of patients with end-stage liver disease and its complications. The people who will be treating hepatitis C in the future are the people who are going to make the initial case identification, because it's going to be as easy to treat this disease as it is to treat other infectious diseases, probably simpler to treat hepatitis C than, for example, tuberculosis. And so we need to review those aspects of medical presentation that allow physicians to pick out patients who need to be treated now and then make a decision about how to go about giving them therapy.